Hey, Becky Oster-Blanton, Active Health Physical Therapy, here to talk to you about pelvic floor dysfunction, incontinence, prolapse, and pelvic pain. All things that nobody likes to talk about. People tell me they're super embarrassed to talk about these problems, but the irony is they're very common. We get a lot of patients coming to us with these issues, and they've had them for years, and they get better. So I'm going to talk about it today and tell you what the first physical therapy visit looks like for somebody who comes in with pelvic floor problems, because I want to take some of this ominous mystery out of it and I want to make it a little more common so that more people are comfortable coming in and getting help. So when I say common, the people we see with pelvic floor problems are basically people that have had kids, which is a whole ton of people that have had prostate cancer, which, you know, the prostate campaigns going around right now. It's 1 in 8 men, right? You've seen the little 8 ball on Facebook or other places. So prostate cancer is fairly common. Anal cancer, uterine cancer, any kind of trauma to your pelvis or even your core, surgery, chemotherapy, and radiation. So if you're incontinent or you have a prolapse, which is where the organ actually descends and is kind of out of the body, or you're having pain with sex or just pelvic pain in general, any of those things could have caused it. Those are not embarrassing problems. Those are like life-changing, traumatic, crazy problems. And the baby thing is a good thing, but it's still very traumatic to your body. So what I want to do is take that stigma of embarrassment away from incontinence and pain. So what I want to do is go through the exam and explain how we do pelvic floor physical therapy, because even some of the doctors that we talk to have no idea what we do in the office. So if your obstetrician or gynecologist or your urologist doesn't know, how are you supposed to know? So here's what this looks like. You come in through our door, you meet the receptionist, and she hands you a pile of paperwork, just like any other patient. You fill it out, she takes your insurance card, the therapist comes out, says, "Hi, my name is." They introduce themselves, and they take you into a room. You're not sitting in a gym full of people dealing with this in public. You're in a small room, and you have a seat, and the therapist says, "So tell me what's going on," and we listen. As long as it takes, you tell us, "I had cancer, I had twins, I had this, I had that. I was in a car accident, and I've had this problem ever since," whatever it is. And then after we listen, we might have you fill out one more piece of paper that is what's called a functional outcome, and it measures the severity of your problem so that we can measure progress. We'll have you fill it out one or two more times throughout your course of therapy, and hopefully we see that it's getting better on the functional outcomes sheet. And it's just some questions, and they're simple and they're short. The next question I get is, do I have to take my clothes off? The answer is generally yes. We actually have you remove your pants and your underwear. You want to do a visual inspection to see if you can see any prolapse. Sometimes we do internal manual muscle tests to appreciate how the pelvic floor muscles feel, if they're stretched out, if they're torn off the pelvis, if they're working at all, if they're weak. But if a patient says, "I'm not comfortable with that," then we don't do it. We figure out a way around it. The other thing that we test is we test the hip muscles, like your glutes, your hip flexors. We test your hamstrings, your core, like your abdominal muscles, your transverse abdominis, your obliques, your lower back muscles, anything that attaches to the pelvis, we're going to take a look at. Because if you're really, really strong on one side and really, really weak on the other side, that can affect how your pelvis functions. It can cause pain. It can cause all kinds of problems. So we take a look at a whole lot of different things. Once all the manual muscle tests are done, we do a range of motion screen to make sure that you're not tight somewhere, to make sure that your pelvic pain isn't coming from muscle tightness, hip tightness, can you move your back? Things like that. Do you have a normal range of motion? And then another big thing that we take a look at is your posture. If your pelvis is tilted one way or the other, sometimes that can affect how your organs sit in there, and it can affect your continence and can affect how you feel. It can give you pain. So while we have you in the room, we do biofeedback, and it serves two purposes. The first purpose of biofeedback is to measure how good your contraction is on your pelvic floor. And the other thing we use it for is to actually exercise. So it looks like this. It's this little box. There's all kinds of different brands. That's just the one we happen to have. And it attaches to these little sticky pads that you put on your pelvic floor. So They go down there. We can put them on for you. You can put them on yourself. We have a diagram. We show you where they go. You can have your spouse do it, or whatever is going to make you do it. That's what we do, because this is the number one key to a lot of these problems, a lot of the time. And what it tells us is, you know what Kegels are, right? Everyone's heard of a Kegel, or if you haven't, it's when you contract the pelvic floor. And says, yeah, I can do a Kegel. And we hook them up to this puppy, and what we find out is a lot of people really can't do a Kegel. Or they're using their butt or their quads or other muscles, and they think they're doing the Kegel. Or you do it, and you can only hold it for a second or two. Well, if you want to have a strong pelvis, you need to be able to hold it for 10 seconds or so. And this little puppy will tell you with a little light and with a noise, it beeps, whether or not you're achieving that goal. So we set goals in here, and we have you exercise with the machine. Once you get the stickies placed, you put your pants back on, and there's a wire that sticks out of your pants, and you plug it into the biofeedback. So the treatment you're dressed for. It's not like you're hanging out naked with us in the office or anything like that. You're totally covered, and everything's discreet. And we do the exercises with the biofeedback. It takes anywhere from 15 to 30 minutes, depending on how strong you are or aren't, or how quickly you learn the contraction. Once we're done with the biofeedback, we take you out in the gym, and we do core exercises, and we try and strengthen your core. And these exercises look like every other person in the gym that has back pain or hip pain. And nobody's going to think like, oh, that guy's incontinent. Nobody can even tell what you're doing. And the other thing we do is we work on posture with you. Because, again, what we talked about with the pelvis, if it's out of, alignment or your organs are sitting in there funny, can make your incontinence worse or your pain worse. So we take a look at different positions and different muscle lengths and work on some stretches, and then it's just kind of basic physical therapy. So that's what I'm telling you, is that the only different part is the exam and just putting the little stickies for the biofeedback on. Other than that, everything's pretty much the same. We see people anywhere from 6 to 14 visits, depending on the severity of the incontinence, the prolapse, the pain, and also how fast they get better. We give a home exercise program with the Kegels. We give you a food diary if you're having issues with incontinence or constipation or any of that. A lot of education, a lot of information on, urination and how it works, and bowel movements and how that works, and how your diet affects it, and how urgency affects it, and how frequency affects it. So you get sent home with a bunch of papers to look at, and you can always email us and ask us questions about it later. So that's the first visit in a nutshell. It's a little intimidating, I understand, but I'm trying to take some of that intimidation away and let you know that there is a cure rate of almost 90%. I have people that tell me they never thought they were going to live any differently, and they walk out of here on their graduation day with 0 problems, a whole bunch of exercises and strategies to make sure it doesn't come back, and my phone number so that if, God forbid, they ever are having a problem, they can call us and come back in, and we can start over or give them a little checkup and make sure that they're still on track. So I want to tell you, too, that a bunch of people in the office have had problems, so we know how it feels. It can get better. You don't have to live with incontinence or with pelvic pain. Give us a call, 878-5002, or send us an email, steve@physicaltherapymaine.com if you want to talk to a man, or me, Becky@physicaltherapy.com, physicaltherapymaine.com if you want to talk to me. You can come in, you can, send us a piece of mail, whatever it makes you comfortable to get started with this process. I'm going to keep posting some more blogs and some videos on further treatment and get a little more in detail, and hopefully some people out there can get help. All right, again, give us a call, 207-878-5002 if there's anything we can do for you. Take care. Thanks a lot.